Chu, and I was sworn in as a member of Congress on Thursday. I may be the newest member of Congress, but I'm no stranger to the fight for quality health care coverage for hardworking Americans, children, and seniors. It's my concern for the health and mental health of Americans that led me to become a clinical psychologist. It is my concern for their welfare that led me to go on to front lines counseling people addicted to drugs as well as victims of rape. And it is at that time that I came to really and truly understand how critical healthcare services are for people's lives. And I came to understand how fragile is the funding for such healthcare services. And that's why when I got elected to the California State Legislature, I asked to chair the Health and Human Services Budget Subcommittee to protect funding for healthcare. Nonetheless, every year when there was a state budget deficit, it was health and human services that was the first to be proposed to be cut. In my district, the need for this bill is enormous. I represent a district in California that has a majority Latino and Asian American immigrants. Whereas in California, 20% of the population is uninsured. In my district, about 33% are uninsured. They are the ones packing the lobbies of the community clinics, waiting months to get an appointment. They are the ones fearing bankruptcy if one of their children gets sick. They are the ones having to choose between paying for prescription drugs or putting food on the table. And that is why comprehensive healthcare reform is needed. The status quo is unacceptable. If we do nothing, healthcare costs will continue to rise, care will deteriorate, and every American will risk losing quality health care. The growing costs are a great deterrent on our economy, and if we are to bring our nation back to fiscal health, we must have fundamental health care reform. And that is why I wholeheartedly support America's Affordable Health Choices Act of 2009. And now I have the pleasure of introducing Dr. Elena Rios from the Hispanic Medical Association. She serves as president and CEO of the National Hispanic Medical Association, representing Hispanic physicians in the United States. She earned her MSPH at the University of California School of Public Health, her MD at the UCLA School of Medicine, and she came to Washington, D.C. when she was appointed to the White House Healthcare Reform Task Force, and then worked in the Clinton administration in Health and Human Services in the Office of Women's Health.